First of all, my name is Glenn Roldan. I'm the clinical director for Redwood Sleep Centers. So I'm here to explain why patients need a sleep study. Oftentimes, your doctor may suspect sleep apnea. And sleep apnea is a disorder where one stops breathing during sleep. It's characteristic for people who snore. So basically, your doctor wants to have a formal sleep study because he wants to know what stage of sleep you're in, how long your respiratory events or apneas are occurring, how loud is your snoring, and so forth. So basically, patients typically come in at night. We have bedroom-like atmosphere, so we try to make it conducive to sleep. So basically, technicians will greet the patient, hook them up with all these monitoring devices. The monitoring devices that we have are EEG leads to record brain wave activity, so we can determine whether you're awake and or asleep, as well as what stage of sleep. We record eye movements to determine whether you're in rapid eye movement sleep or not. We record chin and muscle activity for snoring, as well as periodic limb movements during sleep or leg jerking. We also monitor airflow and respiratory efforts so we can determine how your breathing pattern is. And we also record EKG to monitor your heart rate as well as oxygen saturation. The total hookup takes about 30 minutes. Once a hookup is completed, we encourage patients to try to go to sleep. During the night, you may have either a diagnostic study, a split night study, or an all-night titration study. So a diagnostic study is for the technician just to see how you're sleeping, how loud your snoring is, any pauses in breathing or witnessed apneas. A split night study is a combination of a diagnostic and a treatment. So the first part of the night, the technician is to determine how long your apneas are, and then the second part is to treat with CPAP. And CPAP stands for Continuous Positive Airway Pressure. It's a little mask you would wear over your nose only when you go to sleep. And the way the CPAP works, it works like a pneumatic splint. So the technician is there to determine what pressure is ideal to keep your airway open, thereby eliminating the respiratory events as well as the snoring. The third type of study is all-night CPAP. And we do the all-night CPAP titration whenever you've been diagnosed with sleep apnea. This diagnosis can either be performed by a formal sleep study or an ambulatory test, a home type of sleep study. Okay. So from the beginning of the night all the way into the morning, the technician is going to be putting you on CPAP and to determine what pressure is ideal to eliminate the respiratory events or apneas as well as the snoring.